Today we'll talk a little bit about gallbladder stones. So gallbladder is a small organ situated below the liver. The function is to store excess bile. So gallbladder stones develop because of imbalance between the cholesterol and bile salts and bile pigments. It can also happen if your gallbladder doesn't contract properly. So the gallbladder is supposed to contract and empty the bile into the bile ducts, and if the contractile function is affected, that can result in stasis and gallstone formation. It is more common in patients who are obese and also those who have had a history of rapid weight loss. So not all the gallbladder stones are symptomatic. In those who have symptoms, it's quite typical. You will have pain in the right upper part of your abdomen, which is typically precipitated by eating, especially if you eat a fatty meal. And the pain can persist typically for a couple of hours. This pain can also radiate to your back and to your shoulder, also between your shoulder blades. So along with the pain, you can also have the symptoms like nausea or vomiting. Sometimes the gallbladder stones have subtle symptoms which mimic gastritis. They're not very typical. You might experience some bloating or some discomfort in your upper abdomen, especially after eating a meal. Also, when the gallbladder stones become complicated, like when I say complicated, it can get infected, which is a condition called cholecystitis, or the gallstones can slip into the bile ducts and cause choledocholithiasis. That's stones in the bile duct, which can cause symptoms like jaundice. So you'll develop yellowish discoloration of your eyes, or you may notice your urine is very yellow in color. You can also develop fever with chills, which indicates that you have a cholecystitis. You need to get your gallbladder removed only if you have symptoms due to the gallstones. A silent gallstone does not require any treatment. But however, if you develop any pain or symptoms, then it's important that you get your gallbladder removed to avoid the complications. We cannot only remove the gallstones and leave the gallbladder behind, because the stones form in an abnormal gallbladder, so they will definitely reform. So to treat a gallstone, we'll have to remove the entire gallbladder out. Once we remove the entire gallbladder out, it is not going to alter the quality of your life. You'll be able to eat normally, and there will be no difference in your life once the gallbladder is removed. Okay, so the treatment for gallstones, a symptomatic gallbladder stone, is laparoscopic cholecystectomy. This is basically removal of gallbladder with minimal cuts. You will have small half centimeter, four cuts of half centimeter size on your abdomen. So typically in a patient who has symptomatic gallstones without any complication, gallbladder removal is a day care procedure. We'll typically ask you to come in on the morning of surgery with an overnight fasting, and you'll undergo the surgery that day morning, and we'll send you back home the same day evening if you're comfortable, or the next day morning. Once the surgery is done and you're good to go home, there is no major restriction as such. You can have a normal diet, you can shower, you can go about your normal routine activities. You can also work out and resume work within a week. The only restriction we would suggest is probably avoid lifting heavy weights or any strenuous activity for about a month after surgery.